promotionary healthcare services in the Mid-West region. Deputy Cullinan, are you moving this motion?
I move.
Minister, I move the motion, and can I first of all say, given this is our first opportunity to comment on Justice Clarke's report into the death of Aoife Johnson, that I want to pass on my sympathies to her family, her parents, of course, to all of her friends. And it was a devastating report, Minister, which I'm sure you will agree. And the key finding of the report, that Aoife Johnston's death was almost certainly avoidable, is heartbreaking for her and her family. And I know that anything that we now do to improve healthcare in the Midwest region has to be done with Aoife in mind, but many other families who suffered because of unsafe care at University Hospital Limerick and a lack of capacity. Minister, for a long time now we have been talking about healthcare capacity in the Midwest, and the report from Justice Clarke, as devastating as it was obviously for the family and for Aoife's family, it also very clearly pointed out that the decision that was made all those years ago to close emergency departments in Ennis, Nenagh and St John's in the Midwest region has had dire consequences for health services in the region, because the capacity simply wasn't put into Limerick. And it points to the promise that was made at the time of, we will remove the services in the other areas, but we will build a centre of excellence in Limerick, and that health outcomes and healthcare capacity and healthcare access was going to be better for patients. And I don't believe you, or as Minister, or anybody can say that that has worked out, that the people of the Midwest have got the safe healthcare services that they need and that they deserve. I attended a meeting earlier this year of the Oireachtas Health Committee in Limerick. It was attended by senior management of the hospital, by clinicians, but also by the head of the HSE and by healthcare trade unions, who we had met separately as well. And the head of the HSE and indeed hospital management conceded, Minister, that almost on a daily basis there are patients who present to the emergency department in Limerick who are in need of a bed, but the bed isn't there. They also acknowledged, as we know from our own experience, that far too many people are left in the emergency department without getting the care that they need. It's a highly pressurised work environment for the staff. I think it is very unfair to ask nurses and doctors and healthcare assistants and healthcare professionals to work in a highly dangerous work environment, a highly pressurised work environment where decisions have to be made to save people's lives, where healthcare staff are doing their best, but are doing it in the most difficult, highly charged, highly pressurised situations. I think is a really impossible task that we set those healthcare professionals. So in my view, we owe it to the people who live in the Midwest to provide safe healthcare services. I've always said, Minister, in this House, and I'll repeat again today in the context of this debate, and I say it to you as well, that I believe that every region deserves safe healthcare services. I believe every region should have their healthcare services based on health need, but also based on population, and it also has to be clinically underpinned. So whatever health services that we provide has to meet all of that criteria. But I also have to put it to you that I live in the Southeast, and in the Southeast we have 3 Model 3 hospitals and 3 emergency departments. We have Wexford General Hospital, we have St Luke's in Kilkenny, and we have University Hospital Waterford. As you know, in the Midwest region we have 1 emergency department, 1 Model 4 hospital in terms of University Hospital Limerick, but no Model 3 hospital, which is quite unusual from a regional context. And I think there is a reasonable demand coming from the people who live in the region that that is corrected. Now, I know there is a HICWA report and a HICWA review that is looking at that, but I think there is a very compelling case now to be made for a second emergency department and for a second Model 3 hospital for the region. It's also the case that my colleague here, Maurice Quinlivan, a representative from County Limerick, Joanne Collins, who's in the public gallery, Sinn Féin representative, and many more people. There's been campaign groups, there's people who've been protesting outside the hospital in Limerick and elsewhere for almost a decade, who've been looking for additional capacity in Limerick, but also in the other hospitals as well. Some progress has been made, but nowhere near enough. I published a plan, as you know, Minister, a number of months ago with my colleague, Deputy Maurice Quinlivan. We published that in Dublin. We set out from our perspective what was needed. We need additional beds that get ahead of the problem. We need 24-hour urgent care in all of the hospitals in the region. We need to beef up community care and primary care, because that's part of the problem as well. We need to better organise the emergency department so patients are better prioritised. That was one of the recommendations in Justice Clarke's report as well. So all of that capacity has to be put in, but we also need to look at the other hospitals in the region, and we need to decide what is the best and the most optimum care that we can provide for the people in the Midwest region. So I'm appealing to you, Minister, to work with all of us in that vein, because I want to make sure that the people of the Midwest region have the safe, accessible healthcare services that they deserve. Gord Mogul.
My comments of my colleague, Deputy Cullinan, to the family of Aoife Johnston, and especially her parents, James and Carol, sisters Megan and Kate, and the people in Limerick, the Midwest, and I'm sure across the entire country, wonder and are perplexed as to how a 16-year-old, healthy 16-year-old, comes to our hospital and doesn't come to return home. The Clarke report done on Friday noted circumstances were almost certainly unavoidable, and that came as no surprise to many of us. This tragic and avoidable death should have been the tipping point for the government. It should have been the point where they finally got to grips with their legacy of failure, UHL. But nearly 2 years later, conditions remain unsafe at the hospital. The capacity challenges have not been addressed, and scores of people, including 98 people today and every single day, remain in hospital trolleys in Limerick, in corridors, in wards and in the emergency department. And 2024 will be the worst year ever for numbers on trolleys. There was a recent tweet from the Midwest Hospital campaign, and it named people who died, and I want to put their names on the record: Aoife Johnston, Eva Cleary, Martin Abbott, Martin Cudahy, Niamh McNally, Johnny Reedy and Tommy Wynne. Some of these people I know, our families I know, and they all died. Probably didn't have to. I definitely didn't have to. I'm sure, however, there are many, many other people who've died in this University Hospital, particularly our older people, because of the overcrowding, the lack of care, and we don't have enough staff, qualified staff, enough staff in the department at the time. However, the capacity problems didn't just happen. We've had the problems with overcrowding year on year since a previous Fianna Fáil government opted to close the emergency departments in Nenagh, Ennis and St John's in 2009. This was predicted. When Fine Gael came to power in 2011, we had 3,600 people on trolleys that year. Last year we saw 21,409 people on trolleys in UHL, and unfortunately 2024 we had the worst year in history. The last three ministers, Leah Varadkar, Simon Harris and yourself, Stephen Donnelly, have not made any impact. You failed the people of Limerick and the Midwest. Absolutely. When the previous Fianna Fáil government opted to close the other A&Es in Nenagh, St John's and Ennis, they did so on the recommendation of the Howard report. But that same report insisted that a reduction or relocation to UHL by closing the other departments should not take place until the capacity at Dordal Hospital is increased. This was never done, and yet they opted to push ahead, and we have the outcome of that in the hospital every single day. The capacity challenges have been raised consistently by my party in this and previous Dáil terms. For my own part, I've spoken in the Dáil over 300 times on the matter of UHL, urging successive ministers for health to act and to take decisive action. Again, the necessary action was not forthcoming. The current minister yourself acknowledged in April the reconfiguration of A&E services in Clare, Tipperary and Limerick was not done correctly. But you failed to acknowledge that under your tenure, things have worsened every month and you have not served properly in that role. No doubt the Minister will spin numbers and stats, but the people know you have failed and failed up miserably for them. Under your stewardship, the number of people treated on trolleys, as I said, has increased year on year. In 2021, the figure stood at 12,106, increased in 22 to 18,012, and escalating again to an incredible 21,409. Figures we thought we'd never see, but this year again it will be worse. An incredible 147,000 797 people have lingered on trolleys without a bed in UHL since 2011, the year Fine Gael came into government. And I'll say that figure again. It's 147,000 people, 797 people. These are people deemed in need of a bed, being assessed in need of a bed, but no bed was available over those years since Fianna Fáil have been in government, or Fine Gael have been in government, and it worsens and worsens and worsens. During the Minister's tenure, he's delivered 118 additional beds to UHL, despite knowing there's a shortfall of at least 250. Maybe the Minister doesn't appreciate there's a crisis at UHL. Maybe he looks and sees the only Limerick City TD raising the matter month to month in the Dáil is myself. Maybe he thinks that because his government colleagues hailing from Limerick City are almost muting the issues, that there is no issue. The Clark report, as I referred earlier, noted in relation to the death of Ms Johnson that all the evidence points to the fact that a significant contributor factor to the difficulties encountered in UHL over the weekend of the 17th of 18th December was severe overcrowding, the severely overcrowded nature of the ED on that occasion. But what would it take for this Minister to act or to simply admit he's out of his depth? Maybe government TD from Limerick could tell him. My time is up. No? Yeah. I keep on going, Margaret. What will it take for the Minister to act? Because the March 2022 HICWA inspection of the hospital found it was not compliant in 3 of the 4 categories. The January 23 protests in Limerick where 11,000 people in Limerick marched. Didn't sway him either. But at this juncture, I want to mention the staff at UHL and put on my record the appreciation for the medical staff there. They're overstretched, they're overworked, but despite this, they do the best they can in very, very difficult situations and conditions. I've seen them myself. Anybody who's had a family member treated at UHL will know the medical staff and professionals are kind and do their very best, but they're tired and they need our support. There was 15,000 cancellations at the hospital last year. The emergency protocol, which is supposed to be an emergency, was implemented every single day last year in UHL. The crisis has become the norm at UHL. Successive Fianna Fáil and Fine Gael governments have committed to creating a centre of excellence for emergency care at UHL, but what we've been left with as an ED referred to as unsafe, overcrowded and akin to a war zone where people die unnecessarily all the time. Also in 2023, Professor Declan Lyons, consultant physician and geriatric at UHL, said that the hospital is a national basket case and that the environment in the emergency department is now extremely difficult to work in. It's inhumane and dangerous conditions in UHL. It's time for the government to deliver safe and clinical care in the Midwest region. It's past time for them to acknowledge that there is a need for an additional Model 3 hospital with an ED in the Midwest region. The Dublin and South East region have 5 emergency departments for a population of 970,000 people, yet the Midwest has 1 for 410,000 people. The government needs to develop protect inpatient elective capacity in Limerick and the wider region, separating scheduled care from unscheduled care. Inpatient waiting lists continue to increase. In August 23, there was a waiting list of 4,951. As of August 24, that has grown to 5,348, and they must address the staffing and capacity challenges at UHL as a priority. Friday's Clark report noted in relation to the December 2022 tragedy that there was undoubted fact that the number of patients presenting in the emergency department that night was extremely large, while the number of nurses was 5 less than the full roster, by reason of absences, with the number of doctors being also 1 below full roster. While a significant increase in the number of nursing posts approved for the emergency department has been approved in summer of 2022, these posts had not been filled by December. Sinn Féin is committed to a Model 3 hospital and emergency department. We will also work to establish 24-hour care at Ennis, Nenagh and St John's Hospital. We will add an additional 28 acute inpatient beds, and we will legislate to mandate safe staffing levels in every hospital, with the trade unions to improve paying conditions for all frontline staff. You, however, have no plan for the people of Limerick to get us out of this mess and deliver a healthcare system that is fit for purpose, safe and accessible when people need it. For Margaret.
Dr. Martin Brown.
Margaret, last John Caller. I want to commend Deputy Cullinane for bringing the PME before the House. But before I begin, I want to take a moment to express my sincere condolences to the family, friends and loved ones of Aoife Johnson. The conditions that Aoife encountered when she arrived at the emergency department of University Hospital Limerick should never have been present. Indeed, the conditions that the people of the Midwest have been forced to deal with since the reconfiguration of services should never have been allowed to develop, but they did. Ahead of the removal of the emergency departments at Nenagh, Ennis and St John's, the Hobart report emphasised that a relocation of UHL and the closing of other departments should not take place until the capacity of UHL was increased. That capacity was never delivered, and the consequences UHL being left as a single point of failure with no backup in the region. Most recently, the Clark report reminded us of that by saying, "The fact remains that even today, some 15 years later, the capacity of Dial is significantly below the recommended by the Hobart report as a precondition of closing the other emergency departments in the Midwest region. Even those estimates as to the increases needed to facilitate concentration in Dial are likely to be out of date. Instead, hospital bed capacity in the Midwest is at a ratio that is 9% shortfall compared to other regions. And while there are 5 emergency departments in the HSE Dublin and South East region for a population of around 970,000 people, the Midwest has only one for a population of 413,000. I'll also note that patient and client care staffing numbers across the UHL group have all reduced in numbers in the lifetime of this government. It's hardly right, is it, considering? Effectively, the Midwest has been disregarded like no other region under successive health ministers. Given the failure to deliver on this, a HICWA review of emergency care must be tasked with examining a suitable location for the scaling up of services to provide a partner for UHL. The case for a second Model 3 hospital with an ED for the Midwest region must be pursued. But in the meantime, the issue at hand must be addressed. That's why Sinn Féin would fast-track additional bed capacity for UHL to urgently bring the region's acute bed capacity in line with other regions. And we're calling on this government to do the same. And we are aware of the consequences of this lack of capacity. 21,000 patients admitted to UHL without a proper bed across 2023 alone, leaving the scenes described invariably by clinicians, patients and families alike as akin to a war zone, and management and staff working under intolerable conditions. We're calling on the government to legislate to mandate safe staffing levels in every hospital and expedite the patient safety bill. And additionally, where is the responsibility, Minister? Will you take responsibility for unclear protocols in place to deal with ongoing overcrowding, which lead to patients being placed in the wrong pathway to care? Will you, Minister, admit that the approach followed to date has been wrong, has not addressed the huge pressure that the hospital is under and the consequent failings at a high level of administration to ensure the ED can cope? We need a thought-out, clinically underpinned and urgent response to what is going on here. Our plan involves the development of protected inpatient elective capacity for the Midwest region to separate scheduled and unscheduled care. What we don't need is a response to each crisis that heaps further burdens on the people of the Midwest. Like how many people of North Tipperary are asked to give up places for elderly people at the Nenagh Community Nursing Unit and to farm it out to the private sector as a step-down facility. What we don't need is the continuing crisis response that most recently led to cancellation of elective procedures during the month of August, which again negatively impacts the health and the well-being of people in the Midwest by limiting their ability to get the health care they need. That is why we would also develop a new model of urgent and out-of-care enhanced pharmacy services and 24/7 urgent care at Ennis, Nenagh and St John's hospitals. The latter has been alluded to by this government, but again, the people of the Midwest are left in limbo, with no firm indication that this will be provided. And the people of the region also need the security to know that this location won't hinder an emergency. That is why we are highlighting the need to fund the National Ambulance Service Workforce Plan in order to support rapid access to emergency care. Additional bed capacity for UHL must be fast-tracked. Additional emergency and urgent care capacity is needed across the region. The Midwest deserves safe healthcare services, and we have a plan to deliver capacity to UHL and invest in emergency and urgent care across the Midwest. Gormagat.
Gormagat, Ciaran Corland, thanks to Deputy Cullinan for bringing this important motion forward tonight, and I want to extend my deepest sympathies to the family and friends and loved ones of Aoife Johnson. I want in my contribution just to focus on the issue of capacity and to call out what has been a dominant theme in health care planning in this jurisdiction, in this state, for the last 30-odd years, and that's the issue of centralisation. And we look back to the likes of the Hanley report at the start of the decade, the Teamworks report, and it was always pointing towards centralisation. I remember them well at the time. It felt like they were a foregone conclusion, these consultants' reports, pointing towards centres of excellence. But of course, the experience of communities was something very, very different. It was one of closure, of centralisation, and the lack of capacity, the lack of follow-through in terms of the delivery of supports, services, capacity, and we never saw those centres of excellence. I acknowledge that there was significant progress made on the cancer programme, but that one-size-fits-all did not fit all, and the Midwest region is the exemplar of that failed policy. There were proposals to close emergency departments in Ennis, Mallow, St John's, Dundalk, Nenagh, Roscommon, Navan, and elsewhere, and very many of those, practically all, with the exception of Navan, were closed. In many ways, I would say, by stealth, reduced funding to the services. They were unsafe, they were claimed unsafe, they were publicly announced as unsafe and closed. And in very many cases, what replaced them was equally unsafe or worse. And the truth is that the Midwest could be any region had that policy been implemented in the same way elsewhere. I represent the County of Meath. You're familiar with the case that we have made for many a year in relation to Navan Hospital. It is still stated policy in the small hospital framework. We know, we've heard from consultants at Navan and Our Lady of Lourdes, we want the future of Navan Emergency Department to be secured, Minister. I welcome the reprieve that it has had under your watch, but we need more. We need a similar investment plan for Navan Hospital, for the ED and ICU there, to ensure that it has a sustainable future into the future to serve a really growing population in County Meath and wider. And once we have, as long as we have the stated policy in the small hospital framework that Navan Hospital and the ED there are to follow the likes of Roscommon and Nenagh and Ennis, it doesn't have that's the sustainable future. And I call on you, Minister, to ensure that that policy is changed, and that, like for the people of the Midwest, the people of the North East have the same safe staffing levels.
O'Reilly. And I want to just start by offering my own condolences to the family, the friends and the loved ones of Aoife Johnston. I've read sections of the report and your heart will break in half listening to what happened to her parents, and it must have been so awful, and as the report said, they felt so powerless, and all of the chaos of A&E all around them. My own grandmother died in A&E, and it's not an appropriate place to grieve the loss of a loved one. But my grandmother had lived her life. She had her family. She had lived a very good life. Aoife Johnson's life was only starting, and the grief that her parents and her friends and her family must feel is quite frankly unimaginable. And so I suppose for them, the hope is that some good may come and that some lessons might be learned. But you know, this is not something, this crisis is not something that has emerged in recent times. Before I came in here, I was looking back over coverage of previous times. So back in 2009, when the Ennis, Nenagh and St John's were closed, I was the National Nursing Officer for SIP2, myself and Mary Fogarty, who was the INMO and still is the INMO rep for what was the Midwest Regional, is now UHL. We would have lobbied very heavily government ministers. It was James Riley, and that's how you do your turn and turn about. It's Fine Gael's turn one day, Fianna Fáil's the next, Fine Gael's, Fianna Fáil's, you all support each other. We could see that. And it was James Riley that we lobbied in the first instance, and that conditions were intolerable. I spoke to members that I was representing at the time, and they described the conditions as a war zone, being like a war zone. And in the intervening time, it has only gotten worse. And so I want to use some of my time to talk about the people who are working in those conditions, the people minister who are really effectively, along with the patients at the business end of your policies, your government's failure and successive government's failure. So when hospitals and A&Es are overcrowded, patients suffer, patients die, and staff get assaulted. We know this. It is unimaginable, the conditions that staff are working under. And every promise that has been made, from James Riley to Simon Harris to yourself, every promise that was made to them has been broken. So I'm sure you'll forgive them, Minister, if they take with a pinch of salt any promises that you might make here today. So I would urge you not just to accept this motion or simply nod it through. I would urge you to act on what is in that motion. And if you're not prepared or you are not able to do that, well then I respectfully suggest that you make way for a minister and a government that will. Gormaigat.
Gormagad, and at the outset I want to send my condolences to the family of Aoife Johnson, that beautiful 16-year-old girl who lost her life, and it could have been completely avoidable. And that is the issue here. That is the issue in terms of the health care that we are delivering in 2024. And I would ask how many more people have had their lives cut short because they haven't got the timely health care that they need and deserve. And we don't know exactly, but there are many families out there who know that their loved ones would have lived longer or would be here today had they got the right care on time. Patient safety has to be at the heart of what we do. And the truth is, Minister, that there's so many people today, including members of my own family, that are afraid to access hospitals. They're afraid to go into hospital. How have we come to a situation where people, instead of trusting in a health system, are afraid to go in to access health care that they need? We have to deliver safe health in hospitals in the Midwest, but also in the rest of the country. This should never have happened. Now, Minister, you talk about reform. The Taoiseach was in the health portfolio, and he didn't deliver the reform, nor did any other Fine Gael or Fianna Fáil minister over the years deliver the reform that's needed. Instead, what we've had is report after report of private consultants telling us what should be done instead of getting down on the floor and talking to the staff who are trying to deliver this on a daily basis. Minister, I have to, just while I'm talking about health, I have to talk to you about the constituent I wrote to you about and wrote to Simon Harris about, the young man who has scoliosis and who has been left to wait, and how distressed his family are, that now the diagnosis is now not fit for surgical intervention. And then I have a response from the Taoiseach, who is Minister for Health, and he says, I wish, and names the child and his family all the best, after being failed by this health system, despite being promised in 2017 that those with scoliosis would be treated. He was promised. And I had to look at that child when he was wheeled into my office a couple of weeks ago, and that prompted me to write to yourselves. And you have one passing to the other. You have the Taoiseach passing to yourself, passing to the HSE, and it's nobody's fault that we've ended up in a situation where people's lives are being cut short, such as this. And he wishes them all the best. I'm going to leave it at that.
Just check, the government are not opposing the motion, is that correct? Yep.
Correct.
Thank you for that.
Sorry, I thought Minister Donnelly had clarified. We're not opposing.
Thank you, Minister. So, can I first of all just welcome the fact, Ceann Comhairle, because I think this is the first time that this Dáil, since the 3 emergency departments in Ennis and Nenagh and St John's were closed, this is the first time the Dáil has passed a motion saying that a second emergency department and the second Model 3 hospital is needed for the Midwest region. I think that is significant. I know there is a HICWA review that will look at this. I think that HICWA review needs to focus on where is the best location and what is the best hospital to deliver that second emergency department. I've been in the Midwest probably more than any other region in relation to visiting hospitals and visiting healthcare settings since I took up the post as the opposition spokesperson or Sinn Féin spokesperson for health. I was in University Hospital Limerick 4 times, once with the Oireachtas Health Committee, 3 times on my own meeting with hospital management and clinicians. I've also met with campaigners in the region. I've met with healthcare professionals, healthcare trade unions, and there has been, with respect, different options put forward to me as to what should happen in the Midwest. Some campaigners and some individuals, Ceann Comhairle, have said that we need 4 emergency departments in the region. Some have said that we need a second emergency department in the region. Some have said we don't need an additional emergency department and what we need is to put capacity into University Hospital Limerick. But we do have to land, in my view, on what is safe for the people in the Midwest. We have to have a plan in the first instance that is safe, because what's happening at the moment is not safe. We have to look at population growth and the fact that we have an ageing population and ensure that we're providing the healthcare services which are needed to people who live in the Midwest region. But we also have to have a clinical underpinning of all of the decisions that we make as well, and I think that's accepted across the House. I would hope that everybody in the Oireachtas now accepts that there is a compelling case to not just put capacity into University Hospital Limerick, but to look at what's happening in other regions compared to what we have in the Midwest and acknowledge that there is a need now for a second emergency department and indeed for a second Model 3 hospital. Minister Butler mentioned University Hospital Waterford, and I think we're all proud of advances which have been made in the emergency department there. It's not that that hospital is perfect. It's not that there isn't issues, and when we raise how successful it is, I instantly get messages and calls from people who say, but hang on a second here, I haven't had the best experience, or I've been left waiting in a hospital, maybe on a hospital trolley, but I've been left waiting on a chair for far too long in the emergency department. So it's far from perfect, but it is certainly better than it was, and it is certainly one of the better performing hospitals. But I'm fortunate enough to live in the southeast, where the people in the southeast region, Ceann Comhairle, have access to 3 emergency departments. If you live in the southeast, you have Wexford General Hospital, you have St Luke's Hospital in Kilkenny, and you have University Hospital Waterford. I don't think anybody in the southeast, whether they be from Waterford, Tipperary, Carlow, Kilkenny or Wexford, would accept today if any government said we're going to close 1 or 2 emergency departments in the southeast and said that everybody should go to Waterford. Remember when we had the fire in Wexford General Hospital, and remember when people from Wexford Hospital then had to go to Waterford, and it put enormous pressure and enormous strain on the hospital, and it was the first time at that point that we saw real pressures in the emergency department because we had to take the overflow, rightly so, of patients coming from Wexford. So I don't think I, as a person who lives in the southeast, can tell people who live in the Midwest that they have to continue with 1 emergency department or 1 Model 3 hospital. What we now need to do is to look at how do we scale up capacity. How do we scale up capacity at University Hospital Limerick? All of the beds that the Minister promised are needed. In fact, I would say we do need more. I'm also conscious of what Justice Clarke said in his report, that the site itself in Limerick is coming to full capacity. So the opportunities to actually advance emergency care, acute care, hospital care in the Midwest region will have to be coming from elsewhere, whether it's additional sites in Limerick or whether it's scaling up capacity in other hospitals. I also believe, Minister, that we need to look at elective care in the Midwest region as well. I know the Minister is talking about a surgical hub that will be in the Limerick area, but this state, as you know, is committed to a number of elective-only hospitals. The locations have been chosen, but yet we're not even at the starting gate in reality for most of them. I know it's Galway, it's Cork, and potentially 2 in Dublin, and we're still waiting for sites to be identified in Dublin. We need to accelerate those, but I do believe that we need to look at some sort of elective facility in the Midwest region and in Limerick, because one of the big problems we have in all emergency departments, which causes a lot of the problems, is a clash between scheduled and unscheduled care. Now, I looked on in horror when the people of the Midwest had almost all of their elective procedures cancelled for the month of August, and a bit longer than that. All of them, wholesale cancellation of elective procedures. And it caused consternation for people who lived there. People who were waiting for their appointments, had appointments scheduled, and they had to be cancelled. And the appointments had to be cancelled because of the overcrowding in the emergency department. I also read, and I've seen all of the media coverage of the inquest into Aoife Johnston's death, and it was absolutely tragic, heartbreaking reading. The parents of Aoife were comforting her when she was in the hospital and telling her, Ciancorla, that she was in the right place. We now have a report from Justice Clarke, who said not only was she possibly not in the right hospital, but even within the hospital itself, she was in the wrong area and the wrong section of the hospital. How heartbreaking is that for any family? A 16-year-old beautiful girl who was left for 13 hours without getting the health care that she needs. That report has made recommendations. That report has outlined the challenges in the Midwest region. That report very clearly brought us back to that moment in 2008 and 2009 where services were closed on the promise that a centre of excellence would be built in the hospital in Limerick, and it hasn't happened. So I'm proud of my record on consistently calling for services in the Midwest that are safe, that are clinically underpinned, but serve the people of the Midwest region. And I have always said, and I was asked this on more than one occasion, and I answered, if I was Minister for Health, in a heartbeat, I would deliver a second emergency department if the clinical advice was there to do it. So we now have a HICWA report. That needs to be expedited. We need to see the findings of that published as quickly as they possibly can. They have to do their work, but I believe that that report is going to be very valuable. I hope that what that report will look at is not if there's a need for a second emergency department, but where it should be. I don't, and I'm putting my position on the record here, I don't believe that the region can sustain 4 emergency departments. We have to look at what's possible, what's viable, and also what's safe. We also know that emergency departments in Model 3 hospitals require critical mass. They require volume, and they have to be, to operate safe, you have to have that, and also to attract clinicians and to make sure you have the patient throughput, but also the specialists that can work in those hospitals. That has to be put in place. So I believe it would be big progress for the Midwest if we can get the capacity into Limerick, if we can get the additional beds, the 24-hour urgent care, all of the primary and community care which is needed as well, because that's as important as to what's happening in the hospitals. If people don't have alternative care pathways, if we don't have care in the community, if you don't have the option of home care, if you don't have access to a GP rapidly, if you don't have community intervention teams or chronic disease management teams or ICPOPs, all of those, if alternative care pathways don't exist or are patchy, then the problem is people end up then going to an emergency department who should be treated elsewhere. So part of the solution is also building up capacity in primary and community care and making sure that those alternative pathways are there. But I think it would be a big, big step forward for the Midwest region if we can sort the problems out in University Hospital Limerick. And I think it would be a big, big step forward if we can finally start to plan, and we can wait until HICWID, recommends maybe where a location of a second emergency department or which of the hospitals in the region should be scaled up to a Model 3. But I think that will be a big advance and will finally give the people of the Midwest region the safe, accessible healthcare services that they need. We owe it to Aoife Johnston and her family. We owe it to all of the others, the Deputy Quinlan and others have named, that have suffered in the hospital because of a lack of capacity. We cannot tolerate any part of the country where people don't feel safe going into their own hospital. I just think that's intolerable, where people don't feel safe in their own local hospital, and where you have parents comforting a 16-year-old, telling her that she was in the best place and was going to be looked after, and unfortunately she died. And as the report said, it was a death that was almost certainly avoidable. So for her memory and for her family, but for everybody who live in the Midwest region, let's do what's right and let's deliver the healthcare capacity that the region deserves.